An outbreak of viral conjunctivitis started from Pulungu. We have cases now in Eastern Province, that is in Chadiza, Katete, and a few cases in Mambwe, that is Fuwede School. We've seen a number of cases also in Kabwe and Ndola. This is we call it a red eye or flu of the eye. It's basically a viral infection, like you can have flu and you have all these symptoms of flu. There's also that viral conjunctivitis in the eye, which manifests as very red eye. The eyes are swollen, they're tearing, some bit of discharge. And that characteristic red is extremely red. It's like you had trauma in your eyes. That's how red the eyes are. They're mildly painful, maybe slight headache. I think the last incident we had of this kind of epidemic of viral conjunctivitis was in the 80s. It was called Chongwe by then. It was called Chongwe because the first people who had the disease were seen in Chongwe. So it was named Chongwe. So a lot of people had the viral conjunctivitis, but not everybody. Some have better immunity, they don't get to have it. So patients will have very red eyes, they're itching, they're swollen, and they're tearing, and slight distortion of vision. A few of them will maybe say, I'm not seeing clearly because of the discharge. Yeah, but those usually are the main symptoms and signs that the patient will present with. It's caused by a virus. Mostly it's enteroviruses or adenoviruses. But the one we have currently, we've done some tests through the labs and it's been found that this is the enterovirus. So viral conjunctivitis is very contagious. It's easily spread by contact, using common utilities. Maybe if you're using the same face towel, you're sleeping in the same bed, you are hugging, you are shaking hands, someone is rubbing their eyes when they have the infection, then they greet you, also happen to rub your eye. So basically the prevention is more like COVID. No handshake, wash your hands regularly, sanitize. If someone has a virus, please go to the hospital. From there, stay at home until your eye is resolved so that you avoid disseminating the illness. If not treated, it will be self-limiting, but it will take a longer period of time. So if it's treated, it will resolve faster. So treatment, you go to the nearest clinic, they'll give you some treatment, medications to clear it up. And also you have to maintain very high levels of hygiene so that you don't contaminate people around you, surfaces, and the whole house will end up having the red eye. There are issues of secondary schools or schools where kids, the levels of hygiene are not very good. We have to make sure that they have hand washing equipment, facilities, so they can wash their hand regularly and no rubbing of eyes so that they don't distribute the disease to their friends. The most important thing is for people when they are sick, let's visit the facilities. People out there are most competent to treat this viral conjunctivitis. This is a viral conjunctivitis. It's very treatable, it's self-limiting, doesn't cause harm in the eye after it's been treated. No one will go blind from it. So let's just maintain high levels of hygiene. If someone has the viral conjunctivitis, please isolate, stay at home, and maintain high levels of hygiene. You have the disease, seek treatment, it will resolve much quicker.